Every 13 minutes, someone dies from an opioid overdose, a very sad statement. My first guest knows about this all too well through her profession. Dr. Kiffany Peggs is with us. UnitedHealthcare Community Plan of Tennessee is who she's with. Great to have you, Dr. Peggs.
Thank you.
Let's talk about what exactly is an opioid. That word is thrown about all the time. We hear about opioids on local news, national news. We know it's an epidemic. But what exactly is an opioid?
An opioid is a class of medication that is used to treat pain. There's many different types of opioids that are out there. So there's Vicodin, Percocet, methadone, fentanyl, and there's dozens of other names. Opioids are used to treat moderate to severe pain. So after a surgery, or if you've had an accident, or if you have suffer from a disease like cancer, for instance, you might be treated with an opioid to treat your either your acute or chronic pain.
Okay, so I've heard of all of those that you've mentioned. They've been around for a long time. Why now is there this problem of people overdosing when these medications have been around and people have been taking them for pain? Why now?
That's a complicated question,
yeah.
with a very long, complicated answer. The rise of opioid misuse and abuse is a multifactorial issue. At the heart of it is the misuse of prescription opioids. Misuse meaning you're using it, the medication, outside of what your doctor or prescriber is giving it to you for, or not for the reason why it was prescribed to you initially. That has led to babies who are born with opioid dependence. That has led to the crisis that we have now. We've been studying opioids for more than 20 years now, and as this crisis has increased, and what we've seen is between 1999 and 2015, there's been a 400% increase in opioid deaths in women and a 200% increase in opioid deaths with men. So there's no simple answer as to why now, but we have realized that this crisis is upon us and that we have to do something about it.
It is devastating. It is absolutely devastating. I think 60 Minutes just tackled this recently as well. So there's not really one specific cause, or obviously there's not one answer, and I know that everyone is studying this in this particular field. So what are you doing at UnitedHealthcare to address the crisis?
UnitedHealthcare, we are committed to the opioid epidemic. We are attacking this on all fronts. We are partnering with primary care physicians and specialists in your community to increase awareness and educate physicians on how to treat pain acutely, and then how to also taper people off of opiates if they're needing that assistance. We're partnering with communities to make them more aware of what opiate addiction looks like, and internally looking at data analytics to try to get to the bottom of how can we effectively treat this epidemic, what's working and what's not.
What does it look like? I mean, I think in my own mind, I know of a case, not even in Tennessee, but where someone had delivered a baby. She had a back injury, and it was exacerbated by childbirth. And that child is now 10 or 11, and she is still taking pain medication. To me, that is the face of opioid overdose, or not overdose, but of a problem or dependency. But I'm not a medical professional. Is that an example of what it might look like?
That's one example, but I don't want to overlook how broad opioid misuse and abuse and addiction can look like. It can be the person who does have legitimate pain, but also has not tried or been tried on or even offered alternative pain for their long-term treatment. It could be the person that started taking it for a legitimate reason and then escalated to buying it from the street, taking it from other people, or even worse, escalating to heroin or other substances. So opioid addiction can start many different ways, and it usually does start with a legitimate injury,
yes,
or reason to take it. And the problem is that opioids are addictive, and you don't know how addictive they're going to be for you, and we can't predict that. However, we do know that continued long-term use increases that risk of having the addiction and dependence on the medication.
And there are safe alternatives, and there are things that can help address the pain these people are in.
Yes. Now, I don't want to say that it's a one-size-fits-all for treating pain, but luckily there are many options, and even many more options are available these days. I would say that one, and the most important thing to tell people is, if you have an acute injury, you get a bottle of opiates, you don't need to finish that bottle. Once you start to feel better, ask your doctor about, hey, I'm taking this medicine, I'm starting to feel better. What else can I take that will not have the addictive properties, but also going to treat my pain as I continue to get better? Also, too, for people who have chronic pain, there are a myriad of other options to treat their pain. There is chiropractic therapy, there's massage therapy, there are alternative pain, there's cognitive behavioral therapy, and these are time-tested and treatments that work. So I don't want to undersell them as,
Yes.
you know, this is something that you can try, this is something that has been proven to work, and if it's something you're interested in trying, then you should talk to your doctor about it.
That is just invaluable information you just shared with us. We know some people are really at risk for addiction, and so it's critical for them to know this. How do you get rid of opioids properly in our last few seconds?
I'm so glad you asked. We have take-backs, and we are hosting a take-back April 27th. You can go online and look for your take-back center. There's going to be some all over the state, all over the country, and you just go, take your medicines, and they'll take care of it for you.
Dr. Peggs, thank you so much. Appreciate your time. And thank you for watching today's 50th episode of Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org.